Dark circles are by far one of the biggest skin concerns that I hear about on a very regular basis. People constantly reach out asking for skincare products that they can use to get rid of their dark circles, and it turns out it's much more complicated than that. So for this video, I decided to reach out to some experts to find out what can you really do to treat your dark circles. Board certified dermatologist Dr. Nina Desai, you've seen me do treatments with her. She's been on this channel several times. And then dermatology PA Amy KOBERLING, who has actually shared her skincare routine on this channel and shares a ton of information on social media about skincare. Before I get into the questions with the experts, I do want to point out we're going to talk a lot about in-office procedures in this video because skincare products can only do so much when it comes to a skincare issue like dark circles. So first question, what are dark circles? Because I think a lot of people assume dark circles are similar to hyperpigmentation on your skin, but there is actually a difference in why you get that darkness underneath your eyes.
So dark circles under the eyes are what most people perceive to be this hyperpigmentation around the eyes. However, there's actually multiple factors that contribute to the look or the appearance of dark circles under the eyes. There's the natural aging process, there's allergies, there's dehydration, and there is, of course, genetics. So why do these factors contribute to the appearance of dark circles under the eyes? First, the natural aging process. So there is a fat pad that sits under the eye called the SOOF, or the suborbicularis oculi fat. As we age, this fat pad will shrink or it will sink. That will create this hollowness around the eye. Then the way that light hits our eyes with this hollowness will create a shadow. That shadow will make the under eyelid skin look darker. The eyelid skin is also really thin. It is prone to the loss of collagen and elastin as we age as well. So if we're losing collagen, we're losing elastin, and we've lost this fat under the eyes, the skin is going to be really thin. When the skin is thin, we can see the blood vessels underneath. We've got both red capillaries and green veins underneath the eyes that then contribute to the appearance of the dark circles. Next, we've got allergies. Allergies, either seasonal allergies or individuals who have eczema or psoriasis around the eyes. This will contribute to histamine buildup. Histamine will lead to blood vessel dilation and will have the appearance of more blood vessels under the eyes, thus creating that darkness around the eyes. When we have allergies, we also tend to rub our eyes. As we rub our eyes, we create hyperpigmentation or post-inflammatory pigment around the eyes that can actually make the eyelid skin look darker as well. In addition, if our skin is dehydrated, that's going to contribute to the look of hollows around the eyes and make the under eyelid skin look darker as well. Then there are the genetics. Some individuals are just genetically predisposed to the darkness around the eyes. So take, for example, South Asians tend to be a little bit more pigment prone. So those that have dark circles around the eyes oftentimes tend to look at their family members and they say, oh, okay, there's a genetic component for this dark circle under my eyes.
A little trick is to gently lift the skin underneath your eye in front of the mirror, and if the hyperpigmentation goes away, you know that you're dealing with thinning of the skin or hollowing of the under eye. But if the hyperpigmentation remains when you gently lift that skin off the bone, then you know that you're dealing with hyperpigmentation of the skin itself.
Now, depending on what's causing your dark circles, there are skincare products and topicals you can use, whether they're prescription or OTC, that can help address your dark circles. So we'll get into that too.
So treatment really does depend on what causes those dark circles. If you're one who experiences seasonal allergies or eczema, you want to be on an antihistamine. An antihistamine taken orally will help reduce that inflammation or that histamine buildup in the skin. Therefore, you're going to feel less itchy and you're going to be less inclined to rub the skin around the eyes. You also may want to use a low potency hydrocortisone cream to help calm down the inflammation around the eyes. In addition, whether you're experiencing allergies or dehydration, or there's a genetic component to your dark circles, or you've got that natural aging process contributing, you really want to use products that help to hydrate the skin around the eyes. So products that have things like ceramides or hyaluronic acid are really going to help rebuild the skin barrier. You also want to use products that are going to help promote collagen synthesis. So things like retinoids or peptides will help rebuild those building blocks that we really need to give our skin that youthful appearance and that we really need to help strengthen that thin under eye skin. Oftentimes, there really is also pigment around the eyes, so using products at home that help to break down pigmentation are really important as well. So products with ingredients such as kojic acid, alpha-arbutin, green tea extract, licorice root, and of course, prescription strength hydroquinone can really help break down unwanted pigmentation as well.
The Dr. Dennis Gross Retinol and Ferulic Triple Correction Eye Serum is one that I've personally used for years. It has an encapsulated retinol in it, so this makes it a little bit better tolerated for the sensitive under eye area because this retinol is released over time rather than all at once. This formulation also has antioxidants like ferulic acid and ubiquinone, which is actually present in our skin but is degraded by environmental factors. It also has licorice root, which is known for its ability to target hyperpigmentation, plus some gentle exfoliation to brighten the under eye area. The SkinCeuticals AOX Eye Gel is another fantastic option. It's a little bit pricier, but it has this beautiful serum and gel texture that's really light underneath the eye. It has a range of antioxidants, including fluoretin, vitamin C, and ferulic acid. And this is going to help to not only brighten the under eye area, but also help prevent further damage down the road. A good drugstore option is the Roche-Posay Pigmentclar Eye Cream for dark circles. It has retinol and caffeine, and also some brightening ingredients like niacinamide and resorcinol. Also, I think this tip is really underrated. Make sure that you're applying your sunscreen underneath your eyes. If you already have hyperpigmentation or even volume loss there, this is going to be made worse by repeated UV and light exposure. And an important note is that if any products are causing you irritation, even if it's an eye serum meant to target the hyperpigmentation or the dark circles, you want to make sure that you pull back because any type of inflammation or irritation can actually make the hyperpigmentation worse.
Now, if you've used all of these skincare products and treatments and nothing seems to be working, then you might be an ideal candidate for a procedure. What are those go-to treatments and procedures that experts recommend? Let's hear it.
For those with a true hollowing of the under eye area, a soft hyaluronic acid filler may be appropriate, but this is again where it's super important that you do your due diligence and find a provider that's very experienced in this area. Under eye filler, while it's wildly popular, is not the best option for all cases or even most cases of dark under eye circles. My recommendation is to get a few opinions from a few different qualified injectors and ask them to explain to you exactly why they think you would be a good candidate for this procedure. If one or two injectors say, no, it's not the best option for you, please listen, because you're probably going to be able to find someone willing to do it, but it might end up costing you more down the road in correction. The choice of the right filler product and the right technique is really crucial when it comes to getting an optimal outcome, but in the right hands for the right candidate, this can make a really good difference. It's also important to note that sometimes the filler actually needs to be placed a little bit lower for some mid-face support in order to decrease that transition zone, and that can help with the appearance of the under eye too. So if your injector recommends something like that, don't be surprised, that is an option as well. Platelet-rich plasma, or PRP, is another great option in some cases. This is where we actually take your own plasma proteins and re-inject them into the area of concern. PRP has been shown to inhibit hyperpigmentation, as well as stimulate fibroblast proliferation and collagen synthesis. This translates to thickening of unwanted thinning skin, which, as you now know, can contribute to under eye concerns. Laser treatments can also be a great option for under eye dark circles, but I'm going to recommend some caution in this area because it's very patient and provider specific. There are hundreds of laser clinics in the United States, with more popping up each day, and the fact is that these dark circles can easily be made worse if the laser is done inappropriately or incorrectly. So again, make sure you're doing diligent research, that your provider is well versed in a specific laser and this specific concern. Those patients with hyperpigmented dark circles, which can be caused by things like inflammation, irritation, or even allergies, are probably best suited for at-home skincare treatments or PRP injections in the clinic.
So if you're wondering which treatment is right for you and if you're a good candidate for any of these treatments, it's really important to see a specialist who specializes in dark circles under the eyes and who knows which fillers and which lasers are going to be appropriate for you. As we mentioned before, there are multiple factors that go into the dark circles under the eyes, and everyone's skin is different. And the factors that contribute to one person's dark circles may be very different from yours. So it's really important to seek out a personalized consultation so you know which treatment option is the best for you. So once you've had these treatments done, it's important to know that fillers will last about 9 to 12 months, and lasers do take multiple treatments. And there will be some maintenance, as we haven't really gotten rid of all the causing factors of the dark circles. We can't stop the aging process. Our body continues to make blood vessels and pigmentation as well. So having a good at-home skincare routine is extremely important to maintain your results.
Now, if you do decide to get a treatment done with a professional, it's always important to have a realistic expectation of what your results are going to be, because they can really vary, and it doesn't always mean that your dark circles will completely go away. So that's how you treat dark circles. I want to throw out there are so many people asking about dark circles, so I can only imagine you'll continue to see more treatments that come out, whether that's skincare or even procedures. This is an ever-evolving industry, and whenever there's a topic that is really popular, like dark circles, there is always someone thinking about how to treat it. But if it seems like it's too good to be true, it might be too good to be true. So just keep that in mind. If you have any other questions, feel free to ask in the comments below. I'm going to leave all of the information for the experts in this video in the description box. And of course, you can always find me on social media. I'm at Susan Yara, and I'll talk to you soon. Bye.